So as a continuation of the VSD ventricular septal defect video, we are going to see when is surgery indicated in ventricular septal defect. This is usually asked in step 2 CK in USMLE exams. So generally in ventricular septal, any valve, if the valve per se is damaged because of any infection, so for endocarditis, or when the septum per se is damaged because of endocarditis, then the surgery is indicated. Second, and if the heart develops arrhythmia due to ventricular septal defect, then surgery is indicated. All these are common to other conditions also, like atrial septal defect or other valvular diseases. The third important one is when the patient develops right ventricular hypertrophy. What is right? Why should he develop right ventricular hypertrophy? We know that the blood from the left ventricle comes into the right ventricle. After a point of time, to tackle the large quantity of blood coming to the right ventricle from the left ventricle, the right ventricle undergoes a hypertrophy, which is right ventricular hypertrophy. That means the heart is trying to compensate, but after a while decompensation can be expected. We can't wait for that long, right? We can't allow the heart to undergo decompensation. Therefore, indicated when the patient presents with right ventricular hypertrophy, and when they have pulmonary hypertension. Why should pulmonary hypertension happen in ventricular septal defect? This is because in a ventricular septal defect, the blood from the left ventricle enters into the right ventricle. So the large quantity of blood enters from the right ventricle through the pulmonary artery to the lungs. So the lungs are holding a large quantity of blood and it is staying in increased pressure. Therefore, pulmonary hypertension happens. So when they develop pulmonary hypertension, then the surgery is indicated in ventricular septal defect. What about the other condition? When they develop Eisenmenger syndrome. What is Eisenmenger syndrome? Eisenmenger syndrome is when initially to start with, the blood from the left ventricle enters into the right ventricle. That's how it goes for a couple of years. But after a while, the pressure in the right ventricle is so high and the quantity is also high that the right ventricle starts to compensate by right ventricular hypertrophy. After that, after it beyond a point, the pressure in the right ventricle will be high such that the blood will be pushed from the right ventricle to the left ventricle, resulting in deoxygenation. This generally takes place after around 10 to 12 years. That is, when the child is around 12 years, he will begin to experience cyanosis because of this. So even when they have the Eisenmenger syndrome, that is also an indication for surgery. So having seen all this, this is another diagram which will be given in MLE exams and ask you to find out the condition. I will teach you how to go through this diagram. This is the superior vena cava, and this is the right atrium, this is the right ventricle, and this is the outflow tract of the right ventricle. So if you see here, the SVC is 73%, the oxygen saturation in SVC is 73%. When it goes to the right atrium, again it is the same, right ventricle, again it is the same, pulmonary artery, again it is the same. So there is no problem over here. But here when you see, this is the pulmonary veins which will drain into the left atrium, which will drain into the left ventricle, and the left ventricle will, the outflow tract is the aorta. Here what happens, the pulmonary vein oxygen saturation is 99%, but in the left atrium it is only 96%. This is because of the Sebacean veins. Those are the veins which drains the heart and enters directly into the heart. So therefore, the vein which drains the heart is going to have the deoxygenated blood, and when that enters the left atrium, it is going to decrease the oxygenation from 99 to 96%. Then the 96% has to be present in the left ventricle, right, unless there is a problem. So you can know that instead of the left ventricle oxygen saturation being 96%, it is 85%. So what does this mean? There is supposed to be a mixing of deoxygenated blood in the left ventricle. So from the right ventricle, it is supposed to, it should have entered into the left ventricle. But when does this happen? This happens when there is a ventricular septal defect and Eisenmenger syndrome has set in. Only in Eisenmenger syndrome, the blood from the right will go to the left ventricle, isn't it? So it must have gone, and then therefore the oxygenation is decreased. So this is the condition which happens in Eisenmenger syndrome. Thank you for listening all this while. All the best for your exams.